Hi, everyone. My name is Randi Weingarten, for those who don't know, and I'm the president of the AFT, and we are restarting our Vital Lessons town halls, our monthly town halls. And this is the week of Share My Lessons back to school. So yesterday we had a book club with Jonathan Haidt talking about his book, An Anxious Generation, and the need to really focus on play, and the need to and the reason why so many states are basically trying to do distraction-free classrooms or distraction-free schools from bell to bell because of what has happened in terms of the rewiring of kids' minds because they're on screens so much, and how we are really competing with those screens. That was yesterday. Today, we're going to have this amazing conversation with the series that's been led by our dear friend, Dr. Vin Gupta, who has brought with with us and with him trusted experts to address urgent health topics that affect our students' lives, our members' lives, work, from ADHD to wellness to immunizations and more. And frankly, each of these town halls are grounded in the core principle about truth and about science. And the more we see what the current director of the Health and Human Services is doing, Robert Kennedy Jr., the more we understand how important these separate sessions are that we're doing in terms of these town halls, because we're not getting real information from from HHS anymore and from CDC anymore, and it is very dangerous, and it is actually unwinding the health and wellness of a generation of children. And so today we have a really timely conversation. I hasten to say that some people think of it as a controversial conversation. It shouldn't be controversial at all on immunizations and the new school year, and something that was very much taken for granted a few years ago in terms of immunizations, and why they were important for school kids and the school community. All of that is at risk right now. So as kids and educators and families are heading back to school, frankly, we know that students can't learn and thrive if they're not in school. It's part of the reason we're taking on the absentee issues. It's part of the reason that this summer I talked a lot in my speech to the K-12 Professional Development Conference called TEACH. We talked about how we need to create safe and welcoming environments for kids that have to be relevant and engaging, because we have to deal with the competition we have from these devices. These devices are really our competition. But if kids are sick or if they're absent because of lack of engagement, then that is half the battle. And one of the most important ways, one of the most efficacious ways to keep kids or get kids in schools is vaccines. It's one of the most effective tools we have to protect against preventable illness and to keep the rest of us in the school community safe and healthy. But as I said before, we're living in this moment where misinformation, where confusion, and frankly now the changes in federal messaging are leaving families with many more questions than answers. So tonight is about cutting through the noise. It's about what the research and evidence and science actually say, what's evolving, what is something that is what's basic, what's evolving, and frankly, how to talk about safety and access to vaccines, and how to talk with families about all of this, families that are now bombarded with lots of misinformation and disinformation. So we're going to focus tonight on some of the basics. Routine immunizations that every child needs for school entry. Now, it's different in different places, but in general, what those basics are. Then, what we think is about to happen with the flu, with COVID, with RSV this season, and what those words mean. Third, how are we going to navigate cost and coverage, particularly given the changes of Medicaid, the changes in CHIP, and the changes in the Vaccine for Children program? What does it mean? How do we navigate it? What questions should we be asking? And how to handle the myths, and also the hesitancy with, with responses that are building fear, not trust, and how we counteract that. And we have with us, of course, as I said, Dr. Vin Gupta, who's been our partner in this series and a trusted health guide for us and so many other people, so many families and educators across the country. You see him a lot on TV, and he's always someone who is not only speaking truth to power, but speaking it in a way that those of us that are not in medicine can understand. And we are joined today by Dr. Chokshi, who led the New York City Health Department through COVID-19 and has been a national voice for public health and equity. Many of us who live in New York saw Dr. Dave, as many of us called him, during the pandemic, talking very calmly, persuasively, and directly about what we needed to do to keep our kids safe, our families safe, our schools safe. And it's really an honor to be with you today, Dr. C and Dr. G. And I'm going to turn it over, as we've had in the past, to Dr. Gupta, who's going to lead this discussion for about 30 minutes, and then I'm going to come back. I may chime in every now and then, but we're going to come back and make sure that for the last 15 minutes, take people's questions. And yes, Anna Marie Booth says if there's a fact sheet, we are going to make sure that, like we do with every one of these seminars or town halls, that we put information out right afterwards or as soon thereafter as possible, so that you are armed with the facts, at least the facts as we know it. So that's what we did all last year, and that's what we will do again this year. And so Vin, I'm so excited to be back with you, and take it away.
Randy, and for everybody, Randy didn't mention this, but Randy's joining us just in transit from a busy day. So Randy, as always, thank you for just setting the tone and investing in this through your time and through your team's time. It really starts at the top. And so I can't tell you how fortunate I feel to be able to do this in partnership with you and to have people of the caliber of Dr. Dave joining us. Dave, I'm going to get to you in a second. I just wanted to say, for those joining, I was recounting, and I can't believe that this is our 6th national town hall. We started with a recent past president of the American Academy of Pediatrics back in March, talking about measles, because that's what people wanted to hear about, and we brought the nation's best. We had Dr. Jerome Adams talk to us about ADHD in April. We had 2 leaders in women's health talk about perimenopause awareness in May. We had Dr. Mandy Cohen talk about wellness and longevity in June, and Dr. Peter Hotez talk about autism and vaccines and really debunking some of those myths that we're hearing about. And so you can tell that the goal here is, regardless of political party, regardless of what might be in the news, we are wanting to be good arbiters of your time and to really respect this platform. There's 2 million wide members in the AFT across the country, nurses, doctors, public school teachers. It is quite the catchment. And we really want to build something here that you feel is trusted, that we can then syndicate in the social arena. We've been trying to clip up the most high yield parts of these town halls to then disseminate on social. So the goal here is omni-channel. We're going to distill down all the great info Dr. Dave's going to share with one-pagers afterwards, so that you have information to share with to other teachers or other people in your community. And so this is going to be a living resource. But again, number 6, the 6th national town hall, and I'm really excited about what we're doing. Dr. Dave, without further ado, I thank you for being here. Um, I wanted to, and Kelly, I'm just going to go ahead and advance, but we have quite, Dave and I've known Dave and I've called on him as, frankly, a big brother all these many years, and have just really deeply admired your leadership, Dave, in New York City and across the country. Maybe before we get into the nitty gritty, just wanted to give, just your reaction to the last 2 months of just seeming churn when it comes to vaccines, and how you as a father, as a doctor, think about back to school, and what's giving you hope, what's giving you some pause. Oh, Dave, I think we lost your audio. I think we still lost Dave's audio there. I don't know, Kelly, Dave, when you get your audio back, oh, let's see here. Okay, I think I heard you. I just heard you.
I know I'm back,
no, maybe
but
not.
Dave, are you back?
Looks like maybe, Dave, if you could refresh your browser, it looks like that's in.
Yeah, Dave, if you could refresh your browser and then reconnect your audio, and Dr. Gupta, if you want to move.
Yeah, I'll keep us going, and then Dave will join us. Dave, just chime in when you get back. So what are we going to focus on here today? And Dave, feel free to interrupt me whenever able, and I'll stop talking. So we're going to focus on what to pay attention to, and especially there's been so much churn here over the last 2 months, plus really, there's just so much out there that we want to really wade through. And then we're going to go into the nitty gritty of respiratory viruses. So there's so much that we can talk about when it comes to childhood immunization schedules. And, we're not going to boil the ocean. Yes, there's a whole vaccine schedule out there for children to get ready from basically birth all the way on up until 18. We're going to talk about a subsegment of that, and that's respiratory viruses, and how to be thinking about vaccines against these preventable respiratory diseases. And then what's changed? What exactly is changing, and how should families be really thinking about that? And so I'm going to lead us, and then Dr. Dave is going to join us. But what to pay attention to, and part of this is just staying informed. And every school has a system that's in place, that's informed by local and state departments of health. And so part of this is just making sure, you as leaders in your community are making sure that people are keeping their pulse on what's happening, and that we're communicating about this. Because frankly, I haven't really seen a lot of proactive health communications happening from the federal government on the burden of respiratory viruses. We're seeing, based on the data that is available to us at the state and local level here in the Pacific Northwest, that COVID cases are going up again. There has been effectively no messaging on that from the top down, from the federal government on down, at least that I've seen. And so I do think that there's an information vacuum that exists. And so to the extent that you can maintain a pulse on what's happening in your community, and any proactive communications that might be coming from local and state departments of health, and then diffusing on down to the school level, that's going to be really important. So just make sure that you're asking those questions if you're not hearing any information, utilizing school resources, and then making sure that we're just all staying in communication. And Dave, I know Dave is coughing to suggest to me that he has his audio up and ready, but Dave, I still can't hear you. So I'm going to keep diving in, and I wonder, Kelly, if we can get Dr. Dave to dial in, if there's that option. I do want to make sure the audience gets the benefit of his expertise. So what is RSV? So we're going to focus on three big respiratory viruses, and those respiratory viruses are RSV, COVID, and flu. And the reason we're going to focus on this is because these are the things that typically are what you have to be thinking about every respiratory viral season, every fall season, as to whether or not you need a booster shot. For example, things like meningococcal meningitis, the virus or the bacteria that causes meningitis. That's something that we don't have to necessarily think about getting vaccinated against every fall. Pneumococcal pneumonia, it's a strain of pneumonia that we worry about in young kids and those that are older. Again, not something that we have to think about every fall, at least at scale. The general public does not have to think about that. Chickenpox, varicella, zoster vaccine, not something that we need to be thinking about, again, every single fall. But these viruses, RSV, COVID, and flu, RSV is maybe an edge case here, but COVID and flu are things that we need to be thinking about every single fall. Everybody should be thinking about it, those 6 months of age on up. And that's why we're going to really key in on these three viruses. So RSV, what is RSV? It's a type of virus that it basically, without getting into the weeds here, it's a type of virus that exists in the ether. It just exists in the environment around us. And it tends to really impact those at the extremes of age. So those that are younger, infants under 6 years of age, we're worried about. Frankly, any young child that less than 2, I'd say, is still a concerning age demographic. We are worried about those individuals potentially acquiring RSV if they are not protected, and then ending up in the hospital with an oxygen requirement, just really struggling with pneumonia. And those that are older, 60 years of age and older. Again, it's the extremes of age that we're worried about when it comes to something like RSV. So weakened immune systems, if you have asthma and let's say you're an adolescent with asthma, we're worried about you. And RSV is something that we want to make sure we're thinking about, and at least thinking about, not necessarily that we would do anything, but that would be somebody that we would be worried about. But in terms of getting the vaccine, it's really those at the extremes of age, those less than 2 years of age, and then those 60 years of age and older that tend to have poor outcomes if they're not protected against this virus with this now new vaccine, which was just available last year for the first time. They tend to end up in the hospital disproportionately, those extremes of age. And, RSV is the leading cause of hospitalizations of infants in the United States. So this is not something that is just an abstract concern. This is a big deal. In terms of, so we're going to go through sort of a broad spectrum overview of the viruses. I'm sure no one on this call really needs a reminder on what COVID is, but we're going to do it anyway. COVID-19, like respiratory syncytial virus, RSV, and Dr. Dave actually has COVID. He just coughed. Dave, welcome. I'm glad that we have you here on this webinar, not just in visual, but in audio.
Vin, I'm so sorry for these difficulties. And hopefully, are you able to hear me okay?
Yeah, perfectly. I'm glad you can join us. Sorry for those. For those listening in, Dr. Dave is the guest of honor here, so I want to make sure we get his expertise. Dave, we were just going through sort of a high-level overview of the viruses, but I was diving right into the details as we were waiting for you to join. But I do want to, the initial tee up to you is, you as a major healthcare leader for the country, you led New York City through the pandemic. You speak in calm reason terms, as Randy pointed out. How should we be making sense of the last few months when it comes to vaccine messaging from the government, from the federal government? How should we be staying calm? Just wondering your approach to this, especially as a father and doctor.
Yeah, thank you so much for the thoughtful question. And again, thank you to AFT for organizing this. The timing is perfect, to be able to have this conversation, not just because there is some reason for concern, given the confusion that is swirling around vaccines and vaccine guidance over the last few months, but I think more importantly for our conversation tonight, because we have an opportunity, as frankly we do every time we go back to school, to prevent so much suffering of our fellow human beings, our fellow Americans, not just the children who are served through schools, but also the folks who work in schools, along with all of our loved ones, particularly older adults. And so what I think about, here at the end of August is how seriously we should be taking this opportunity right now. Because in just a few months, by winter's end, what happens every year is that RSV, influenza, and COVID-19 together claim more lives than all other infectious diseases combined. But the fact is, much of that can be prevented, particularly through the immunizations that we're going to talk about. So amidst all the swirl that we may be hearing on the news and from the federal level, there's so much that's in our control with respect to making sure that we take advantage of this opportunity.
That's great, Dave. Thank you. I know we had just gone through sort of, as you were joining, just a little bit on RSV, but we're going to take each virus in tow. I had said to those that are joining us across the country that we're going to focus on RSV, COVID, flu. Did you want to expand the conversation to other sort of childhood vaccine schedule, or are you comfortable limiting it to that as kind of what we have to be thinking about every fall? That was the frame that I wanted to leave with.
Yeah, well, why don't we talk about it a little bit in terms of, what folks should be thinking about back to school more broadly than what we call the respiratory viruses. But then I do think we should dive in a little bit to flu, COVID-19, and RSV. And here's where I'll start. And of course, I know we'll have Q&A. And so if folks have questions about this, we should dive in as well. But basically, to go to school in the United States, kids need to be up to date on a core set of vaccines, as you know. The list does vary by state, but it's largely the same everywhere. And in general, the time when we check the records for kids is when folks are entering kindergarten. I have a daughter who just finished kindergarten, and so we went through this, at the beginning of last school year. And then again, when kids enter middle school, and then there's a final sort of checkpoint, at the end of high school and before college. For the younger kids, the diseases that we have shots for that need to be up to date are DTaP, that's diphtheria, tetanus, and whooping cough. MMR, which is measles, mumps, and rubella. I know you had a session on measles earlier this year, and of course, we've seen outbreaks of measles around the country. Polio, chickenpox, and hepatitis B. And so those are, sort of the list of diseases for younger children. Before middle or high school, kids need a booster for tetanus, diphtheria, and whooping cough. They also need additional protection with a vaccine against meningitis. And in most places, at least, HPV vaccines are strongly recommended. Rather than, worry too much about this litany, I just want to point your listeners to the right resources for this, and there are two. The first is healthychildren.org, which has all of the immunization schedules, particularly from the American Academy of Pediatrics, which is what I recommend following. And then the second is via immunize.org, which has a list state by state of what the requirements are related to back to school vaccinations.
And what we'll do, thanks, Dave, I appreciate that. One thing coming out of this is we're going to work, and just for our audience and for syndication purposes, great, perfect. It looks like Kelly, thank you for getting those on there. And then I'm going to throw one last one in from AAP. Oh, I actually threw in the CDC, which was an older link. I'm going to have the AAP website, and we're going to put in a list of resources in our one-pager that I know many of you are familiar that we ended up publishing. That second link there, sorry folks, from the American Academy of Pediatrics. We'll make sure that everybody has a one-pager with these citations and references that Dr. Dave is notating, so you don't have to go search. But thank you, Dave. And if you click on that last one, especially from AAP, it's pretty busy. There's a lot there, but it gives you based on how old, say, your child or your if the students in your class, or if you yourself are a parent, based on where they're at age-wise, what they need or what they should have already gotten, and then to think about catch-up vaccines. If you've missed a vaccine, think about that. Dave, maybe a quick word on, I sometimes get, and I field them to my wife, who's an actual expert in the childhood vaccines, she's a pediatrician. What's your approach to catch-up vaccines, and how should, what's the best sort of way to, if you're a parent and you think you may have missed something for your child, how to best counsel them on catch-up vaccines?
Yeah, well, first I'll say I've talked about this with my wife as well, who's not a pediatrician, but is an educator. And particularly here in New York City, we get a lot of folks coming in from different places. And so this is, this is an issue that we have to grapple with. The short answer, of course, a lot depends on individual circumstances. And so the best advice is to speak to the child's pediatrician about it and make sure that the child has a pediatrician in the first place. But the short answer with respect to advice is, what I find is that people sometimes think that if you've missed a few doses of the vaccine, that you have to kind of go back to the beginning in terms of the immunization schedule. And usually that's not the case. Usually there are ways to give catch-up doses to be able to get the child back on track with respect to their immunity.
We just put 3 links on, immunize.org, healthychildren.org, and AAP. Do you feel like one is better than the other? And so one question kind of we're getting is, what's the difference between the 3 that you recommended? And then what is the difference between all 3 and what the federal government is putting out there? Yeah,
great. So let's talk about that a little bit. First of all, I want to keep it really simple. There's the healthychildren.org website is something that the American Academy of Pediatrics helps maintain, but it's really directed toward parents and other lay people. And so if there's a single, website with all of the up-to-date information from the perspective of a parent or a teacher or someone else, it's really healthychildren.org. They have the immunization schedules that, we doctors look at ourselves, but in a way that's just a little bit more digestible than what you'll find on the American Academy of Pediatrics website. Immunize.org is a different website that hosts many different resources, but that's specifically if you're looking for your state's schedule with respect to what vaccines are required at certain points of schooling. So that's really what I'm pointing to immunize.org for. And then the last part of the question that I heard was, how do these differ from the federal government? And I want to be very clear that in many ways they don't. For flu and RSV vaccines, for example, the recommendations are the same. And so, we shouldn't miss the forest for the trees when it comes to the fact that flu vaccines are universally recommended for everyone aged 6 months and older this season. You can start getting them as soon as September. For RSV, again, who is eligible is the same. We can talk about some of the nuances here, but in general, it is pregnant women, infants, and then adults ages 50 and older, those who are 50 and 74 if they have risk factors, and those who are 75 and up, everyone. So flu and RSV are the same. The place where there is some divergence, and it's the first time that it's happened in the 90-year history of the American Academy of Pediatrics, is with the COVID-19 vaccines. There are a couple of key differences. One is that the American Academy of Pediatrics does recommend it for all children under the age of 2. I also have a 2-year-old daughter, and so I pay particular attention, to these recommendations. And the reason for that is that we know that COVID-19 has particularly serious consequences for younger children, for infants. And that's true even for healthy infants, not just for a child who may have an underlying condition. And then the American Academy of Pediatrics also recommends for kids aged 2 and 18 COVID-19 vaccination for those who are at higher risk, but importantly, for any child whose parent desires the protection of a COVID-19 vaccine this season. So that was a lot of information, I know. Let me pause there.
No, it was great. I mean, it was great. And for everybody watching, and I know we have some questions coming in, Dave, I'm going to ask you those in just a moment. We are going to distill this down into a fact sheet, and then we'll provide you some links to resources. And very helpful, Dave, to understand healthychildren's.org's resources and why they're different, and helpful, perhaps for a lay audience, and how they differ from immunize.org and AAP, which, I think a little bit more meatier information, but a little less easy to navigate. So that's great. We are getting Anna Marie. I appreciate a lot of the push on fact sheets. I promise you we're going to get that out to all of you ASAP. You did ask a question about the updated, speaking about the updated COVID vaccine for 2025, 2026. Dave, I've gotten this question a bit as well, which is what can people expect, knowing that there's been a lot of churn, knowing that there's been some changes to people that are advising on what these booster shots should look like, and from a sort of a strain perspective. Do you have a sense of do you know what we can expect when it comes to the COVID booster shot, both in terms of, you just mentioned FDA indications are changing, but will this be accessible? Is it going to be updated? Or will pharmacists be able to give these shots in retail pharmacies across the country? I know there's a lot there, but curious if you can take us through that.
Yeah, certainly. Look, the big picture is this. COVID-19 continues to cause suffering among different groups, particularly older adults, but also children and adults, particularly those with underlying health conditions. And so we can do something about that, which is vaccination against COVID-19. As we have seen over the last several years, there is an updated formulation that comes out around this time each year. It's matched to the circulating strains of COVID-19 in a way that is similar to what happens with the flu vaccine. So there is an updated formulation that will be available this fall. The recommendations are nuanced, and so let's parse those through a little bit. I talked about the recommendations for children. Those are expected to diverge from the federal recommendations, although we don't have total clarity on what the federal recommendations will look like. But in general, the recommendations from the American Academy of Pediatrics mean that more children would be recommended, to get the COVID-19 vaccines. For adults, let me start with what is unequivocal, which is that if you're 65 years or older, or you're an adult with an underlying condition, this could be something like diabetes or emphysema, or you've had a heart attack. If you have one of those underlying conditions, regardless of your age, and then if you're a senior, meaning 65 years or older, COVID-19 vaccines are recommended for you. And there's no daylight between what different groups are saying for those populations. Where we do think there will be more controversy is for adults who fall outside of those categories. And the indication that we have is that the FDA label for COVID-19 vaccines this fall will change. And that does mean that it may be harder for adults who fall outside of those groups to access a vaccine if they desire that protection, for two reasons. The first is that some doctors may feel less comfortable with prescribing a vaccine off-label. We do, and you know this yourself, Vin, we often do prescribe therapies off-label, but there are some questions and considerations about that, and the reality is that people may be more or less comfortable with that. The second consideration is that pharmacists, and last year pharmacists administered about 90% of COVID-19 vaccines. If the label changes as expected, then it will be more difficult to get COVID-19 vaccines from your pharmacist again, if you fall outside of the groups that I mentioned, 65 and older, or adults with an underlying risk condition. So I'm going to take a beat there again.
No, that's great. Dave, thank you, Dave. What does that mean if you're, say, 50, you live in a multi-generational household with grandma, grandpa, you're worried about them. You're 50 though, you don't fall into a clear category, but you want to get the vaccine. What is that, one, in terms of access, how does somebody go about, in your view, doing that? And then is that a conversation with their medical provider? So that's part one of that question. Part two is will their insurance pay for a vaccine that does not formally align with, let's say they don't fall within formal guardrails or recommendations from the government, from the federal government? Who's paying for that vaccine if that person wants to get vaccinated?
Yeah, well, let me start with, again, the simple answers here. Number one is, as a doctor, I would recommend that that person get vaccinated. You know, they have a compelling reason. We do know that COVID-19 vaccines, even though they do not completely prevent transmission of COVID-19, they do reduce the likelihood of it. So someone who wishes to protect a loved one whom they live with is a compelling reason, you know, to get vaccinated, particularly given the very strong safety profile of COVID-19 vaccines. So that's just from the clinical perspective, you know, why it matters. How to go about doing that is a more challenging question. And what you alluded to, I think, is the right way. You know, if that person has a primary care doctor already, they should have a conversation with that doctor and see if they're able to get vaccinated, you know, through that person's clinic. If not, that's when, you know, they may have to search around for a doctor who is more comfortable prescribing a vaccine off-label. And then the coverage question is a really important one. The good news here is that all of the indications that we have thus far from health plans, that is health insurance companies, is that they will continue to cover vaccines the same way that they have in previous years. So that means if you were able to get a vaccine without a copay, without other forms of cost sharing, which is true of virtually all vaccines that are administered, then that will remain the case for this fall. You know, these things may evolve in the coming months, but as of today, you know, that remains true for virtually all health insurance companies.
Dave, we got a question follow up. Can you give us your view? What does it mean for something to be off label?
Yeah, great. So basically, you know, an FDA label is, it specifies what a particular vaccine or medicine is used for and to whom it ought to be administered. And so sometimes doctors may prescribe medicines or vaccines in a way that is called off-label, meaning it doesn't totally hew to the FDA approval for that vaccine or medicine. It may still be warranted. There still may be a clinical reason, you know, for someone to get that vaccine or medicine, but that's what we mean by off-label.
Excellent. Thank you, Dave. Just a push for everybody. If you have any questions, we have Dr. Dave on for about 15 more minutes. And I noticed the poll, free-form text, thank you, Kelly, on what folks seem to be wanting kind of coming out of this in terms of content that we can share. Short videos, explainers was at the top, and then fact sheets right after that. So it looks like this is getting updated in real time. So fact sheets is now number one. We hear you loud and clear. In terms of, Stacy has a question in the chat as well about vaccine updates for adults. And Stacy, you know, just to round out and make sure we're being responsive, you know, the things I like to, I'm just looking at my notes here, the things that I like to make sure adults think about with some frequency, or are at least thinking about, you know, based on milestones and what ages they've reached. Shingles vaccine for adults 50 years of age and older. Have a conversation with your medical provider. There's two versions of the shingles vaccine that exists. The one that you can get at 50 and older is the one that's more widely adopted and favored, and it's something that I highly encourage you to do. At least have the conversation. The pneumococcal pneumonia vaccine, so word jarble, we talk a lot about pneumonia. Pneumococcal pneumonia is a pretty darn, it's a form of bacterial pneumonia caused by streptococcal bacteria. It can be deadly, and it is a big problem. That is something that we have a vaccine for. And actually the age in which we recommend people to get that vaccine has lowered over the course of time. And now it's 50 and above. Again, just speaking about adults, have that conversation with your medical provider about the shingles vaccine once you hit 50 and above, pneumococcal pneumonia, or you can, otherwise it's kind of known as just the pneumonia vaccine. So you just bring that up, and I'm sure your primary care provider will know what you're talking about. And then Dave, over to you. I know we talked about COVID, talked about flu a bit. RSV for adults. Can you walk us through that? This is a new thing over the last 12 months. Your approach to how you counsel your patients about the RSV vaccine.
Sure, and I'll just pick up where you left off. You explained it so clearly, Vin, and I just wanted to add, we know what the 3 most commonly missed vaccinations by adults are. You talked about shingles and the pneumonia vaccine, and the third one is the tetanus booster, which is recommended every 10 years. So, those 3 should be on everyone's list. And then the 3 that we're really focusing on today are flu, COVID-19, and RSV. And so to your question, we've talked about flu and COVID-19 already. One thing I want to just emphasize is that it is possible to get flu and COVID-19 vaccines together. And often, people wish to do that because the side effects that you get, the sore arm, or sometimes the mild, chills, or headache, that you might get with vaccines, you kind of can consolidate those side effects, over the course of a couple of days. And so I do always, recommend co-administration for people who are up for that. And then let's delve into RSV just a little bit. There's really about protecting both ends of the age spectrum. RSV is the leading cause of hospitalization among children. And that's why, it's wonderful that we have these new immunizations, particularly that protect infants. This happens either if pregnant women get vaccinated during pregnancy, it's between 32 and 36 weeks of gestation, then the antibodies that the mom develops get passed on to the newborn and help to protect that child in their first months of life. And if for whatever reason the mother does not get vaccinated, we now have these new products called monoclonal antibodies, which also help to prevent RSV. And Vin, I just want to, comment on this for a moment, because when you and I went to medical school, none of this existed. I remember one of the first patients that I ever took care of in a children's hospital was an infant who was struggling to breathe, making grunting breaths, their nostrils flaring, the skin between their tiny ribs being sucked in, with every single breath. Because RSV can really do a number, on vulnerable infants in that way. And here we are now, and we can actually prevent, so much of that. And then on the adult end of the spectrum, so first of all, let's start with the easy thing. Those 75 and older, everyone is recommended to get vaccinated against RSV. Importantly, this is not a seasonal vaccination. This is usually a single dose of the RSV vaccine. And then for those aged 50 to 74, it's about vaccinating people who, again, have a reason to be at higher risk. Those are the conditions that we've talked about before, like diabetes, emphysema, or someone who's had a heart attack. One thing I'll highlight is that this is slightly different than the recommendation last year when it was for adults aged 60 to 74. And so now, that age range has been extended a bit to those aged 50 to 74.
Excellent. Thank you for that clarification. Dave, I'm going to ask you a few I'm going to pepper you with just lightning questions here. you had mentioned co-administration, COVID flu. So for the kiddo that's about to begin school or already is in school, once the updated shots become available, when will the updated shots become available, and when would you recommend is ideal timeline? I get this question all the time. When should a child, much less an adult, ideally aim to get vaccinated for robust protection throughout sort of cold and flu season?
Yeah, it's a great question. And, my short answer is it doesn't matter a whole lot, as long as they get vaccinated toward the early part of respiratory virus season, which generally starts in, October, November. So, if the shots are available in September, as they should be, barring any unforeseen circumstances, it takes about 2 weeks for the vaccines to actually help people build up immunity, and then they have protection, that lasts for several months beyond that. So to recap briefly, get them as soon as is convenient for you. I would say September, is fine, but certainly by October or November is ideal.
Randy, I see you popped on, please.
Yeah, I popped on because there's so many, as you have gotten to many of them, there's so many good questions here, but they kind of fall into about 3 different categories. One is give us the fact sheet because we're not getting it from the CDC or HHS or, so many other places. So, that what we've been talking about over the course of time, Vin, about making sure there's that kind of fact sheet is really, really important. I just want to reassure people we're going to do that as best as we can. The second is this whole intersection about what's not only what's recommended, that's the second, and for whom, but also how does it get paid for anymore. And the third is, what happens if we're saying one thing and HHS or, CDC is saying something else. And so I just wanted to throw out those kind of swaths of questions to you, both of you, because I'm sure that people who are not doctors, now are like, oh, wow, Robert Kennedy is saying X and we're saying Y. Who should I be listening to?
Yeah, Vin, do you want to?
I know the answer to that. That's why we have us. But I think that, we have to figure out a way to reassure people in terms of what the basis of our beliefs are.
Yeah. Look, I'll start just by acknowledging it's not ideal to have, these different conversations happening, among different quarters. And what I would recommend is to think about who it is that you trust, not just at the national level. We've talked about some of the places where I can vouch for the scientific integrity, for example, of the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the American Academy of Family Practice. But equally importantly, the folks whom you trust locally. These are your local and state health departments. It's the local clinicians whom you go to, for your seasonal vaccines every year. And I can tell you there's a robust conversation happening among people who care about preventing suffering to make sure that there is good, sound, science-based information being disseminated across those channels so that the onus is not totally on each of you to sort this out for yourselves. But you have, people whom you already trust, whom you can turn to. And look, I don't want to sugarcoat it because there are going to be real challenges given what's happening, with respect to federal vaccine policy. But also there are some straightforward ways that we can continue to transmit information in a way that makes sense for figuring out what you need to do for yourselves and your families.
So if you have a physician, go to that person. And yes, keep your records. And it's terrible that we have to do all of this, but we have to do all of this.
Yeah.
And we'll have, the best advice to everybody who's listening. We'll have the best advice to you about what the range of recommendations are.
And I just want to call out, Dr. Dave, just for our audience here, Randy, I appreciate the CEO. Dr. Dave has been leading an effort called the Common Health Coalition, where he is regularly talking to these medical societies. And it can sound, there's 79 medical societies that I know Dave and his team are engaging with. They're all generally saying some version of the same thing. And I think they're all saying the same thing. And so when Dave says that, it comes with, he's leaning in deep with these experts who, by the way, the leaders of these medical societies represent entities like the American Lung Association that I'm a part of. Every lung doctor across the country, to some degree, has an affiliation with the American Lung Association. And so it's in some ways very hyper-local, these medical societies, and they're they have their fingertips and their sort of fingerprints rather everywhere. And so I think that advice is great advice. I want to, Randy, if it's okay, I want to I want to just ask Dave a few more questions, and then Randy, I'm going to kick it back to you for some closing thoughts. Dave, you had mentioned, so we're thinking maybe middle to end of September might be a good timeline to, once the vaccines are updated to get vaccinated. It takes about 2 weeks. The co-administration, does it matter what arm? Sometimes people, you have to one in each arm? Could it be both in the same arm? I'm seeing I've gotten a lot of questions in the lead up to this about that.
Yeah, the short answer is no. It doesn't matter a whole lot. Usually when I recommend it for my patients, I do recommend it in one in each arm, but either one works if someone has a stronger preference. Okay,
great. So we're going to put this all in the one pager. I know this is, I'm asking tactical questions because everybody needs to plan. I did get one last ask, and then Randy, I'm going to kick it back to you to talk about at-home flu vaccine. And I know, Randy, you have to go real quick, and we'll put this into the one pager. This is available now between 2 and 49 years of age. So if that's relevant to you and your family, something to check out. It's an innovation that has long existed, but it's gotten better, and now it's available for at-home administration. So something just to check out. And Randy, any last parting thoughts? I know you're en route here.
Well, I do think, first off, thank you so much, Dr. Dave, and thank you so much, Vin. I do think it's really important for us this time to have the one pager because it will give people what the circumference of knowledge is from all of these societies, and it will create some comfort, but also people have it. And when they go to their physician, there may be times that the physician is going to have to write a script for something. So it's going to be covered by healthcare as opposed to what has been covered by before. So I think that it's important that we keep on trying to advocate for the, for the work, for making sure that people are healthy and have the vaccinations they need, not just in terms of the respiratory vaccinations that we spent a lot of time on, but the general vaccinations as well. So I want to just basically say thank you, Vin. Thank you, Dr. Chokshi, for this amazing night of, information. And we will keep on trying to make sure that we get our members and the families they serve the most accurate, scientific-based information possible in terms of, because the more information people have, the better off they're going to be. And everything is about, for us, keeping people safe and healthy, both individually, family-wise, and community-wise. So thank you, Dr. Dave, and thank you, Dr. Gupta, and back to you, Kelly.
Great. Thank you, everybody. I know Randy has to go catch a flight, so safe travels, Randy. Thank you between Randy and Vin for coming up with this incredible series that I get the honor to work with these two individuals and produce this series. This is night 2 of 3, but many more nights to come of our back to school webinar series with the AFT. All of our webinars are on demand and recorded, and this year for our book club and for our vital lessons. So if you're an educator, you can get professional development credit for joining us. So you should be able to download that certificate now. Tomorrow, I will be running the webinar, not behind the scenes, running our EdBrain, your new AI teaching assistant. So join us tomorrow for that session that we have, talking about our new AI tool that we have on Share My Lesson. And then stay tuned, because I'm working with Dr. Gupta on our plan for September and October and November on these different health plans. And then also, very exciting, Randi Weingarten has a book coming out on September 16th, and she will be our September book club feature. So be sure to pre-order Why Fascists Fear Teachers, Public Education, and the Future of Democracy. Thank you, everybody, for joining us, and I hope you can join us tomorrow for night 3 of our Back to School series. Good night now.